So I've been working with a group of experts in France to set up a program allowing us to simply get all the solution from A to Z in computer-guided implantology. You will see that it's not simple, but we've been simplifying this in 3 modules. The first module is called You Treat, because we need to import images and we need to treat them. The second module is called You Plan. We plan the case, we plan the implant. And the third is the design that we call the U-Design. U-Design is just designing a surgical guide, or designing a guide to place implant, or designing a guide to trim and to prepare the bone. Whatever you want to do, you will be able to do it. So this is implemented in a program which is called AccuGuide. AccuGuide is for accuracy. So let's see what we can import. This platform is a fully open platform. We can import spiral CT scans. We can import DICOM files, multi-DICOMs coming from CBCT. We can also work on a double scan technique. What does that mean? This means that you can overlay one DICOM over another DICOM. We call that the double scan procedure, and this is used when we used to overlay a second CT scan of a full denture over the CT scan of the patient wearing the denture. This allows us, since 2001, to work on the gingiva with a surgical guide applied and supported at the gingiva. This is a very important step that was done in 2001. We can work with optical scan. An optical scan is when you want to increase the quality of the support of your surgical guide, you need to get a good image. This image is coming from a plaster cast, coming from an impression of your patient jaw, and this is scanned with an optical scanner. You have several optical scanners here, and you will see what it is, and it's very accurate, and it's more accurate than the quality of the CT scan that you can get. The new development is the intraoral scanners. So I am going to show you how I have been using an intraoral scanner, and I have been designing the jaw image, and I have been overlaying this jaw image over the CT scan. This is the highest development today that we can have in this technology, and I'm going to show you a case with that. And also, we keep the format, proprietary format, that you can go backwards and forwards in the same program, so no need to start from scratch again if you want, or if you forget to treat fully the image and you need to do it later in the program. This is U-Treat. Let me show you how it looks like. It's an open system, as you understand. The interface is very friendly, and I get that from people who are using that. They all say it's very easy to use. Yes, because we've been making a real effort to go up to this level. It's very fast, and the learning curve is very short. So the program allows you to draw a panoramic curve that I call an intelligent panoramic curve. We draw 1, 2, 3, 4, 5, and 6 points. Double click, we validate, and we get the panoramic curve. The panoramic curve is intelligent because you can move some points, and you will see on the lower that we can see all along the path of the inferior alveolar nerve. And this will allow you to draw the nerve in a very fast and a very easy way. Let me show you what we can do now in 3D. We need to work in 3D, and we have a certain number of tools that you see on the left side, and these tools can be customized, and this will give you the threshold of reconstruction. You work on a 2D to build a 3D. You click, and all what is above the threshold that you decided to set, this will give you a 3D image. We've been setting a threshold at 500 Hounsfield unit, and we get the image of the bone and the image of the prosthesis. Now I am going to do a second 3D image, which is called the prosthesis. I set up the threshold, I go around 1,300 and something, 200, okay? I click on the prosthesis and I'm making a second 3D image, which is the image of the prosthesis. Now I am going to select the bone. I am going to use this Boolean tool, minus, and I remove the bone. From the bone, I remove the prosthesis, okay? And now you get two images. You had one image, a 3D image of the bone, and one image is a 3D image of the prosthesis. So you see, and this will be the support of the guide because it is laying on the soft tissue. So you see how easy it is today to work on these images. By the time we used to do that layer by layer, 1 millimeter by 1 millimeter. This is finished. You see some artifacts there. You see the yellow points on the left side, on the right side, and we are going to remove them. I am going to use the magic wand. The magic wand is on the left side. I select the guide, I click on this, and when I click on the bone, it removes automatically all the other images which are not linked to this. Again, the tools are simple to use. That's the objective. The objective is to get tools that we can easily use. Okay? So I want to draw a nerve. I go to the nerve, and I select plus, new nerve. I go at the entry of the inferior alveolar nerve. I click outside, inside, and I go all along the nerve in the panoramic reconstruction. Once again, it's easy and simple to use. This is the objective, okay? You draw the nerve in 2D, and you draw the nerve also in 3D. Drawing in 2D allows you to have the drawing in all dimensions. And that's an important thing. When we work on the lower, we always draw the nerve when we are working on lateral windows. Let me explain to you now a thing which is basically very important to understand when you work in 3D images. You have two ways, only two ways, to show a 3D image. One is called the volume rendering, and one is called the surface rendering. I show that to you on an example. I had an impacted tooth here. It's a second molar which was impacted, and I needed to take a decision. Should I remove it? Is there a risk with the inferior alveolar nerve? The OPG is not enough to take this kind of decision. I went through a CT scan, drawing the panoramic curve, looking at the nerve, and drawing the nerve. This is a volume rendering image. This is the image you have when you use a CBCT. It is a cloud of images. It's a cloud of points in the space. When I look around like this, I see that there is an impacted tooth. But it's not enough for me to make a right decision about what I should do with this tooth. Is there a risk? Is there no risk? What is the risk? What will be my decision? That's what I want to get. Can I get it with this volume rendering image? No. I need something more. So the second step is the surface